Greetings, everyone, and welcome to another session. Got a brand new series titled Under the Microscope. So a warm welcome to everyone and a happy new year for 2023. This is our first session of the year, and I hope this finds you well. It's 5 p.m. where I am in Brisbane. How about with you, everyone? Let me know your time and your location. Just type it in the chat, everyone. Just waiting for everything to come along live. Hello to all our YouTube people. I can see lots of people in YouTube. Just close off that. If I've got any support out there, I can see that the OET Center Facebook stream may not have loaded, so just waiting on that one. And hello to all the YouTube people. I can see lots of people. Hello, Babita, and tell me your location. Hello to Gina in UAE. We have Anika in India. Hello. Hello to Sunita in Nepal. Saju is in India. We've got the UK here. Facebook's just come on live. That's fantastic. Hello to Zambia. Welcome, Pakistan. Hello to Saudi and Kenya. Hello in Australia, where I am located. Kuwait is here. Wonderful. That's great. And we have Anika in India. Just let me pause, silence that one. There we go. I'll just put in a shout out in the Facebook chat as well. All right, I think we got all the media working, everyone. That's wonderful. Good to see. All right, so yes, as I said, this is a new series that we're going to do, and it's called Under the Microscope. So every month we'll come back and we'll do a new session. We'll analyze a different part of the exam. They're going to be short sessions, about 30 minutes long, but packed with information, so that you can use that in your own preparation. So without further ado, everyone, let's get started. Now I'm going to bring up my screen, my PowerPoint, and this is our session. Don't forget who we are. I'm Steve, the director at OET Online. There's our website. Come and check it out. Got some great study options there if you have an exam coming up soon. So, first question I have for you. Do you find writing a challenge? Are you able to meet that challenge? And there's just a few things, and I want you to respond to some of these questions and just share with me perhaps some of the challenges that you face with writing. Do you find it hard to complete the task within the time allowed? You've got 40 to 45 minutes. Are you able to organize your letter and get everything down within that time? Or do you find you're running out of time and you're under pressure? Are you unsure what information to include and what to leave out? You've got a lot of content there. You've got to think about who you're writing to, and it can be quite tricky to decide, is this really relevant or not? Would the reader know this, or do they need to know this or not? Perhaps it's an optional. You may include it, but you may leave it out. These are tricky things that you need to decide before you start writing. Do you find it difficult to organize your letter in a clear manner? Perhaps you're not sure what information should be prioritized, what should come first, what should be in the middle, what should be at the end. That's a challenge. Do you find that your letters are too long? Perhaps you're having a bit of difficulty summarizing that information, or you're including non-relevant information and you're ending up with a long letter. That's also a bit of a challenge. And do you find it hard to focus on the main issue? Can you actually drill down and find what is the crux, the essential elements of that case? All right, these are all challenges, especially under exam conditions. So I have a solution for you, everyone. So if you answered yes, you are not alone, but there is a solution, and the solution is ISBA. Tell me if you know about ISBA, everyone. It's a wonderful tool. It's used in standard practice across hospitals across the world. Doesn't really matter what your profession is. You can use ISBA. Doesn't really matter what type of referral letter you have to write, whether it's a discharge, an admission, a transfer, a letter to a specialist. ISBA can still work for you. So what actually is ISBA? Type in yes if you know it, and any comments on it, let me know. I'm just looking at my chats here. There we go. I'll just bring that up. All right. Some people say they don't know it, and some people, they do use it as an assessment. Yep. So it is a common thing, I think. But if you don't know it, this is a great opportunity to apply it to your writing. Oh, pardon me. Just let me close that down. Pardon me. There we go. All right. Let's bring it up. So ISBA, what does it stand for? Well, it's an acronym. Health is full of acronyms. I stands for introduce and identify. That means you can introduce yourself. You can, if necessary, you can introduce your patient. So we can always say, who are you? Where do you work? What do you do? Perhaps that you're in a hospital. Perhaps it's a home visit. Perhaps you're a specialist. So who are you in relation to this patient's care? Then who's the patient? Then the standard information to identify: name, age, gender, marital status. That's pretty common, useful information. You can add occupation to that as well. And then why are you writing? That's vital. We know for OET, we get marked on our purpose. So we must state the reason for the referral or the letter. So why are we writing that letter? So that's what I is, everyone. Now, S stands for situation. What's happening now? What, where, when, how severe, all right, to your patient. What happened? Maybe they had an accident, trauma. When did it happen? They have certain injuries. How severe are those injuries? Are they life-threatening, for example? If it's a hospital situation, is there an admission date? Is there a diagnosis you want to mention? What are the current or the most, or what's the observations at times of admission in this case? Now, one thing I'll say, you can use this in paragraphs so that you have this information you put in your introduction, but sometimes you're going to put that situation, part of the situation can go into the introduction. So we could draw an imaginary line here where we want to put what's happening now in the introduction to give that reader a sense, right? But you don't really know that until you see the type of letter you have. Sometimes the situation is quite detailed, so you want it to come in a paragraph on its very own. So when you get a tool like ISBA, remember, it's a little bit flexible, right? You can adjust because as you will know as health professionals, every situation's a little bit different. Every patient has different needs, and you're always writing to different health professionals. So Subhashini says, can we follow the same format for all the letters? Not necessarily the same format, but you can apply ISBA to all the letters. That's the key, right? Because ISBA has some inbuilt flexibility, right? So we've spoken about that. We've mentioned the first two. We've mentioned I, introduce and identify. We've mentioned S for the situation. B is for background, information related to the patient that has led to the situation, i.e. relevant past medical history, medications, allergies, relevant social information. You can put that information in the background, right? Then we move to assessment. Assessment is very important, particularly if it's a discharge. For me, assessment comes after, it's not the condition on admission. The patient's been admitted, the patient's been treated, tests have been done, results have come out, you're assessing that patient. So what is happening now, just at the point of discharge, for example, what's their current situation? That's the assessment, the latest information. Commonly can come after background. And then you've got your request. What do you want the next health professional to do? Could be like a discharge request. Sometimes requests could take a whole paragraph. There's quite a lot of information that you need to give to the next person taking over the care. Other times, the request is very small. You just want them to provide further investigations, right? So the amount of information under each heading can vary. Okay, so that's the key there. And remember as well, if it's an urgent referral, you may change the order. That this B for background can come after the A. So it is possible to invert this so that the situation and assessment flows. Remember, this helps you organize in paragraphs, but once they're in paragraphs, they can be moved around based on what you think is the most important for the reader. So always in OET, you will have to make that judgment. But the good thing about ISBA is it gives you structure, paragraph structure. All right. So that's what ISBA is, everyone. Now, let's look at how we apply it. So I'm going to give you a sample letter. So the first thing we've got here is to introduce and identify the patient. And in this case, we're going to talk about the situation. So it's, in this case, you're writing to a community health nurse at Eastern Community Health Centre. We've got an address. We put the date underneath. Dear nurse, Mr. Peter Dunbar, and we've got a date of birth there. All right, let's read it out, everyone. I'll read it out aloud and then we'll analyze this, see if it's a good introduction. So I'm writing to request ongoing care for this patient, an elderly widower with diabetes who will be moving to Centreville to live with his daughter. Okay, that's quite a bit of information there. Mr. Dunbar's wife died in December 2021, and he has been under our care for the past 18 months. Wow, we've described the situation, everyone. It's a 2-sentence introduction, and it really captures what's going on there. So it's really good for OET, with OET criteria, because it helps align our purpose. It provides the relevant information, the request for ongoing care, very explicitly there. All right. We've got the age of the patient. It says here he was born in 1936, but I really like this style of writing because that we can, if we do the math, we know that he's well over 80, getting close to 90. So we can say elderly. It's a nice way. It makes it real. We've stated that he's a widower. We know his wife has died. Remember, widow for females, widower for males. We've got the chief complaint. Well, he's got diabetes, and that's a big part of this task. So we've stated his medical condition. But what's unique about this one, and the reason why I think it would get a lot of bonus points and would be well considered by OET examiners, is it just gives that extra information about the situation. So I like putting the situation if it's appropriate in the introduction. So he'll be moving to Centreville to live with his daughter. Useful. Remember, he's an elderly patient and he's on his own. So we've got that context. So we need to put in information about the next of kin. It's why he needs this support. We've also mentioned his wife died in 2021. So we've provided that background. And also we know the duration of the care that you've been providing as the nurse doing the referral. He's been under our care for the past 18 months. So we know the community health nurse knows you've been caring for him for 18 months. A lot of useful information. All right. And the other thing I like, everyone, about this one that we've done, sometimes people say we shouldn't use the word patient, but when we say this patient, it gives us a little bit of cohesion. So that means we're linking back to our subject line. So I wouldn't say the patient in the body of the letter per se, but this is one opportunity where you can use this to create some cohesion, everyone. All right. All right. That's our introduction, everyone. Now we continue on. So now we're going to talk about the background, right? The next part, right? This is all the background. Let's read it first, everyone, and we'll see what aspects of language. Questions welcome as we go along. Mr. Dunbar was diagnosed with type 2 diabetes in 2020, for which he has been prescribed metformin. So we mentioned diabetes in the introduction, and we didn't mention when the diagnosis occurred, and we didn't mention the medication. So we're now expanding, providing more detail, and it's flowing from the information we've already given. He has a history of non-adherence to his medication regime. Okay, we've identified a problem. And we've mentioned the medication first, and now we've mentioned non-adherence. And then we've got comma, stating poor memory as the reason. All right, so we've used a gerund there to start our participle clause, stating poor memory as the reason. So that's another issue. That's a bit of a red flag, isn't it, for the reader? Okay, this patient also has, may require memory support, okay, because of a memory issue here. He has also been resistant to any dietary changes or alcohol reduction. Okay, that connects to non-adherence. Not only is he having difficulties with medication, but there are also other issues relating to diet and alcohol. So that's all the same topic. His condition has steadily deteriorated, and since October 2022, he's displayed signs of diabetic neuropathy. So again, dealing with the severity here. His condition's getting worse. And that links. We mentioned steadily deteriorated, and here's an example of the deterioration. His mobility is impaired and he walks with a stick. He was hospitalized following a myocardial infarction in June 2022, which led to a diagnosis of atrial fibrillation. He was commenced on ramipril, warfarin, and sotalol at the time. So now this is a little bit less important information compared to the diabetes, but it's useful background information for the reader. And then we look at, let's look at the content criteria that's used by OET. Well, we've included the relevant medical history. There was other aspects to the history that isn't mentioned here because it was non-relevant. So always select your information carefully based on what will help the reader continue that care. You'll need to make a judgment. The main issue of non-adherence, and Gina mentions, doesn't mean not following. Exactly. If you don't adhere, adhere is like glue, adhere to stick. So in this case, you're not sticking to the medication regime. You're not following it. You're non-compliant. All right. So we've mentioned the non-adherence to medication and also diet and alcohol intake. And this is important. We've identified that the patient is deteriorating. His condition is getting worse, and we're also have put plenty of dates there that indicate that deterioration. All right, so that's the background information, everyone. Now we go to, we're still on ISBA, everyone. We've introduced, identified, described the situation. We've given background information, but we're not done yet. We've got to talk about assessment and request. Now, this one, assessment's quite small because it's not really a hospital assessment. All right. Mr. Dunbar presented to our clinic today, accompanied by his daughter, who will cook his meals. It would be appreciated if you could support her, the daughter, with education regarding how to care for a diabetic patient. There's our request, everyone. Read that again. It would be appreciated if you could support her with education regarding how to care for a diabetic patient. It's very clear. Please note, his non-compliance to medication, diet, and alcohol intake has remained an issue. So careful monitoring and encouragement is required. All right, so we're saying what needs to be done. It's part of that request. We've also added, we've mentioned that this medication, diet, and alcohol that he had earlier on in his background, it remains an issue. It's still current. So that's part of the current assessment, and it's also part of the request. That's why he needs careful monitoring. So that's the current situation. If we look at the criteria for conciseness and clarity, helps us write in word length. In this case, we have a clear and concise summary of the relevant information in the case notes. There's no wasted words or superfluous words. The non-relevant information has been omitted, and we're really avoiding repetition. We have mentioned things like compliance. There's a few things that are mentioned again, but they're mentioned in the context that it's a bigger issue or a continued issue. All right. And then we end up with a letter like this, everyone. Presto, we have a lovely letter, and this is a letter of transfer that meets the requirements that OET examiners are looking for, right? So this is your goal, everyone. Let's see why it meets those requirements. So firstly, it follows that ISBA format, right? So you want to make sure when you're writing, try this ISBA format. It will become your best friend. You can always use it. And this is the criteria, organization and layout. So we know we can feel confident when we use this, that we've grouped the information clearly and it's easy to follow because it is standard practice. The timeline is expressed clearly without appropriate time references. Now this, you can use lots of signal words in your writing, but if you look at this one, there are very few signal words. You don't see an in addition, a furthermore, these sorts of words. You can use those words to a degree, but really when you're writing, the best signal words you can use will always be time references, right? Because you're describing a patient history. So we've got December 21 when his wife died. We know we've got present perfect. He has been under our care. So you've got your verb has been aligned with for the past 18 months. That's perfect alignment. Verb tenses and time references need to align. It's an important area of study. If you're at the beginning stage and you're just brushing up your grammar and you're getting on track, learning the tricks of the trade, so to speak, this is one of the very important aspects that trips up a lot of new writers. We've mentioned past tense was diagnosed in 2020. We've got another present perfect, everyone, has steadily deteriorated. Again, that's present perfect, using it with since. We said was hospitalized, that's passive, used with in June 22. All right. We've mentioned today, and we've also used this one at that time. So lots of lovely time references that makes that very clear. And I can't emphasize enough for you how important it is that you manage that your verb tenses and your time references are in alignment. Practice that. We've got a criteria, genre and style, a very important criteria. And you've got to sound like a health professional. And in this case, this writer does. We've got a lot of professional vocabulary appropriate to the task. Look at some of the phrases here, everyone. Very, very nice indeed. We've got things like under our care. That's nice, nice phrase. That word non-adherence, and he has a history of non-adherence. It's a formal writing style. medication regime. And some of these words may have been borrowed from the case notes. You can get a lot of useful information. You can borrow from the case notes and expand in your writing. So maybe the case note said he didn't want to change his diet, but we changed that to dietary changes. So that's good vocabulary range. Maybe the case note said, alcohol arrow down, or alcohol is increasing. So we've got resistant to alcohol reduction using those noun phrases. Steadily deteriorated. Deteriorated is a good word. We've spoken about his mobility, and we've got non-compliance here. So great range of vocabulary there, everyone. It's clinical and factual, just states the facts. And remember, you need to be polite. So saying he's an elderly widow, you wouldn't want to say he's an old widower. He's an elderly widower. So that's polite. And we're also using politeness for our requests. It would be appreciated if you could support the daughter. That's polite. And should, we could use if. Should's a nice polite way. So it's a polite conclusion. So we'll get good marks for genre and style. And the last criteria, everyone, is language. Now, when you write, if you practice enough, you'll automatically have a range of different sentence structures. So you're going to have some simple sentences, some compound, and some complex. But it's your job to study and make sure you're comfortable with sentence structure. And that's hard work. So you've got to put in the time so you're confident with your sentences. Study where needed. Verb use, I mentioned before, it's got to align with the time references. You've also got to get your passive and active form correct. Very important, and that's just practice. You need to expand on the case notes, and you've got to get your prepositions and articles, all that mechanics of language. That's got to be accurate. And lastly, punctuation and spelling. And if you can get all those things right, get all those boxes ticked, then you know you're meeting the criteria. All right. So that's the key, everyone. What I'd like to see you do is follow ISBA. Try it in your next practice letter. When you do it, feel confident that you're aligning with the OET Center criteria, and your score will go up, everyone. All right, I'm going to open up to questions. That's our writing letter under the microscope. That's what you need to do. You can adjust this to your own style of writing, or for whatever profession you are. So use ISBA and pass OET on your next attempt. And if you want more of this, welcome to add any questions, everyone. But if you want more on this, this is a little example. I know there's lots of people from the Middle East here, but you could be from anywhere. At OET Online, we run 2 classes per day, every day, Monday to Friday, at times that suit you. You can see today is a Wednesday. If you're in the Middle East, there was a reading class earlier in the day at 2 p.m. Oh, sorry, no, coming up, because it's only in the morning for you. So, for example, today we have a reading class coming up at 2 p.m. Middle Eastern time. We have speaking coming up at 10 p.m. Listening classes, grammar. If you're an allied profession, we have 2 allied profession classes per week. That's pharmacists, physios, dentists, occupational therapists, and so on. Nurses, we have writing classes for you. There's one coming up tomorrow if you're in the Middle East. And there's also every Monday we have one. And doctors, we have an evening class. We also have 2 writing classes for medicine every week. So you can come along and attend those classes. And of course, grammar is a foundation for us. So we're always working on grammar. All right. If you visit our website, you can see the timetable for your region. And don't forget, everyone, we have a free taster course. Doesn't cost you anything. Come and check out what we do. If you like it, sign up. We get a lot of success from our students every week. So I look forward to helping you pass OET on your next attempt. All right, hope you can apply that to your writing. Any final questions, just drop it in the chat now. All right, looks like everyone's good. I hope you like these short, snappy sessions. I'll be back in February for another short, snappy session. So I look forward to seeing you then. Keep your eye on Facebook and YouTube channel. And the very last thing I'll do, I'll just bring up one more thing, everyone. Let me just share a link with you. If you haven't been to our website before, come along here and check it out. As I said, we have a free trial course, but you can log in. All you have to do, everyone, is to create a new account. So you want an account, check out what we do. I'll just drop that in the chat for you all. Courses do cost money, but they're great value, everyone. We understand your location, so we always try to provide value for money. But also remember this, everyone. You know, you don't want to take the exam multiple times. Think of what that costs you. Being thoroughly prepared. You're health professionals, you know how important it is to be well prepared in all aspects. So, yeah, if it's what you're looking for, come and check us out. All right, thanks very much, and we'll see you in a month's time, and wishing you good progress and success in your next attempt. Bye for now.